Welcome back to Channel 17 Investigative News Series.
Since the discovery of stem cells in the early 2000s, there has been a swirling of scientific hype around this revolutionary discovery. Misleading articles told the public to expect treatments in the next few years. However, clinical research to test stem cells' safety and efficacy has left the public waiting much longer than that. This disparity between the public's want for treatments and the proven research has allowed the rise of fraudulent stem cell clinics who offer untested treatments to uninformed patients.
Today's news segment deals with the legitimacy of two stem cell clinics. These clinics are branches of the California Stem Cell Treatment Center. They are located in Beverly Hills and Rancho Mirage, California. They claim to treat a number of diseases using unproven, unregulated stem cell treatments. Some of these diseases include Parkinson's disease, multiple sclerosis, lupus, arthritis, and many heart diseases. These stem cells have not been proven by scientific research to treat or cure any of these diseases. Clinical trials have proven very few number of stem cell treatments to be safe and effective, but most are experimental. But what are stem cells? Stem cells have received a lot of recognition in the past 20 years for their astonishing ability to become seemingly any cell in the body, and even potentially repair entire organs. While certain types of stem cells, such as embryonic stem cells, can become any other type of cell, the type of stem cell used by the California Treatment Center are mesenchymal stem cells. They are also known as adipose-derived or fat-derived stem cells that can only become similar cells such as bone, muscle, or cartilage. Despite this, the treatment centers claim to be able to use these stem cells to treat varied diseases such as asthma and multiple sclerosis.
The Californian treatment centers and other similar stem cell clinics get away with using unregulated treatments such as these because they classify their treatments as 61, meaning that the stem cells they use undergo little to no manipulation and therefore don't need to be regulated by the FDA. This loophole allows illegitimate clinics such as these to go under the radar. However, the treatment this clinic is offering should be classified as a 351, which involves more than minimal manipulation of the stem cells and requires FDA approval. The treatment involved harvesting fat cells from the patient, isolating the stem cells through a process called stromal vasculifraction, and then injecting the stem cells back into the patient. Elliot B. Lander and Mark Berman are the co-founders of the Cell Surgical Network, which connects many stem cell clinics, centers, such as this one. These stem cell treatments are carried out by real physicians, and those in the California Stem Cell Treatment Center do hold valid medical licenses and board certifications. However, these physicians specialize in fields such as urology to orthopedic surgery, and not necessarily fields regarding stem cells and their use. These clinics have been investigated in the past, as in late August of last year, the FDA seized 500 doses of smallpox vaccine, which a different clinic in the Cell Surgical Network claimed to be mixing with patient stem cells to cure cancer. The FDA described this treatment as an unapproved and potentially dangerous treatment of cancer.
The network's website, stemcellrevolution.com, creates profiles for all of their practicing physicians. They tend to highlight how high profile these doctors are, providing their medical schooling and credentials. While these doctors are licensed professionals, these treatments aren't proven, and their high level of credibility means uninformed patients are more likely to trust and pay for these not-so-safe procedures. To further investigate the legitimacy of this clinic, we called to ask some questions. We posed as a person with a relative that had rheumatoid arthritis. Our first question was how much the treatment for arthritis would cost. Their answer was $8,900, which we deemed explicit and acceptable. Next, we asked how long it took to see results, to which their answer was 6 months. We asked how they got this number, and they answered that they followed patients after the treatment, although they had not published any of their findings, which seems suspicious. The clinic also said they were in the process of getting FDA approval, which contradicts their website, where they claim that FDA approval was not necessary for their procedures, as they claim to already meet the guidelines for approval. Finally, we asked how long the treatment would take, to which they said 3 hours, which is short for diseases thought to be incurable. Moreover, they specified that the treatment is meant to treat and not cure, which, while it is good that they do not exaggerate by claiming a cure, it is suspect whether their treatments are even remotely effective.
So this clinic claims that their medical practice is effective for the treatment of various diseases, including multiple sclerosis, Parkinson's, asthma, rheumatoid arthritis, neurology, and more. But there's little to no scientific evidence to suggest this. Even if you're being optimistic and assume that the mesenchymal stem cells, which is the clinic's main form of treatment, have the complete and absolute tissue healing properties, which isn't the case, it's unclear why that is even relevant for conditions such as asthma. And when we asked for some research or scientific data, they basically dodged the question and flaked on us and said that it was an ongoing process. And their website has a couple of anecdotal events, but there isn't any real scientific evidence to suggest that their treatment is at all effective. The FDA regulates human stem cell products and the clinics which offer them through the Federal Food, Drug, and Cosmetic Act and the Public Health Service Act. With these acts, they have the legal authority and responsibility to regulate biological materials such as human stem cells. According to the clinics, or this clinic, they don't exactly need FDA approval for their clinical trials / research because the stem cells undergo no manipulation. However, on the phone interview that we had, they said that they were trying to get FDA approval, meaning that the cells do undergo some form of manipulation. And furthermore, on their website, the clinic says that they use stromal vascular fraction to prepare the stem cells, which is a process that involves the introduction of digestive enzymes and growth factors to harvested fat cells. And this is considered to be more than minimal manipulation and actually requires FDA approval.
This is an important issue for the public to be aware of because the number of clinics such as the ones we discussed today is growing, and not only in the United States. Other countries have more relaxed laws related to stem cell research and testing, and the possibility of a cure for debilitating disease is often enough to convince people to make rather rash decisions. We would like to reiterate the statement made at the bottom of the clinic's website that you should consult your physician before making any decisions related to stem cell treatment. These clinics do not claim to cure the diseases they list, only to possibly treat them. Make sure to inform yourself about the risks associated with treatments such as these before making any decisions. It is our responsibility to be informed as the public and spread the knowledge about the risk of agreeing to treatments from these clinics that are not FDA approved and claim to do miracles through stem cells.
Thanks for watching Channel 17. I'm Bill Gates, signing off.